disabled person who can no longer express themselves, going back to everything we talk about with INVEST, is critically important in this time. And something I want to remind everyone, we have our INVEST and we talk about the identity of the individual and the value and what they enjoy and what they treasure and how they feel safe. That information that you've been collecting over all these years and that My Life and that kind of storyline that we do is very helpful in this time to provide care in these type of circumstances. So the goal for today's call is to really talk through some key points on safety, key points on resident care and clinical care, key points on engagement, and key points on support. So we're at a stage here when we talk about mitigation, is that everything that we're doing in terms of hand hygiene and infection control and disinfecting and social distancing is really the key instrumental practice to help decrease the spread and transmission of this virus. In memory care, it can pose itself to be very challenging considering the population that we're working with who cannot follow direction or instruction and things of that nature. So we're going to talk about that today and hopeful that we can give you some best practice tips to help continue to mitigate and in some cases contain if in fact you have a resident that is already have a positive diagnosis of COVID-19 in your building. Pardon me. So we're going to go through some of these slides. Again, they're best practice tips. We'll talk to, drop your questions into the chat room. We have other clinical personnel on the call as well. I believe Joe Reed, Marie Michaels, and Deb Ussery are also on the call to help orchestrate some of the Q&A. And Chrissy Kressler also is on the call to help orchestrate some of those Q&As for engagement. And also Brett Jefferson on the dining side for safety. And also keep in mind the chat room is not just for questions, but again, this is about sharing right now as a family, as a company, all in this together. So through certain things, feel free to pop in a couple best practices to do in the chat room, okay? So we're gonna get started. For those that are not on mute, please get yourself on mute. I hear a few different phone calls and I know that Mark is hopefully trying to figure out who those people are and to get them on mute. There we go. Okay. So mitigation and containment, what we've been talking about as my introduction here is the type of population that we're caring for, obviously smaller communal living. And we're having residents who are difficulty already expressing their needs, also understanding the changing environment, seeing that, dining service is now in their apartments, group programming is not large groups, constant reminders for social distancing, constant reminders for hand washing, employees dressed in goggles and masks and gloves and walking around, and that's what they're seeing. So there's a lot of unrest that is very commonplace in our care and memory care because of these changing circumstances. And we also are well aware that our residents have the impaired ability to follow or remember instructions, such as simple hand washing, wearing a mask, refraining from placing things in their mouth and touching their face, which we know firsthand is one of the easiest causes of spread, is being able to touch a hard surface and then touching your eyes, your nose, or your mouth. And we see a lot of our residents who do not practice that type of infection control. And also staying in the room for dining or particular area, and just the constant reminder of social distancing, something that we're all challenged with, as we know some of our residents who like to wander, who like to walk about, like to get into things and like to follow you around. It's very difficult to keep them in their rooms. So we'll talk about that today too. So the solution here that we are sharing is that we're trying to implement different strategies and best practices that can assist in mitigation and containment in 5 areas: nursing and resident care, infection control, safety, engagement, and support. The resident care and the nursing side, nursing is actively doing checking temps, but have also now included the vitals of all Alzheimer's residents per shift. This will allow them to continue to document those vitals to see any shifts or changes. What we're also looking at, residents with a temp, we would consider presumed positive. That means full isolation and PPE protocol. What we need to remember too is that residents with Alzheimer's disease or related dementia are not necessarily going to be able to verbalize that they don't feel well. You'll see this in different ways. So outside of testing on temps and things of that nature, you may see someone who might be in pain, being extra tired, but they're exhibiting different signs such as agitation. Maybe they're going to be wandering a little bit more. Maybe they're having some verbal outbursts. Maybe they become a little bit more withdrawn. You'll see some behaviors that are not typical of a resident and things that we need to be aware of. Because that could be an underlying trigger for pain, hunger, thirst, bathroom, things of that nature. So things that we need to be continually monitoring. It's not just vital signs, but also change in behavior. What are you seeing? What seems a little bit different? What seems a little bit off on that individual? And, really putting in, as we've been talking extensively about the hospice providers that are coming into our building that are primary, that are individuals that have been identified within your space to be in a full need, but also someone who's maybe consistently in the program to kind of bundle them into the care model, have them help with more physical assistance with feeding if they're there, bundle them into the dedicated care team, is also an approach to increase your bandwidth too. On the resident care side, what we're seeing too is back in the day, it would be, pardon me, let me go back here. 1 second. The primary care assignments, we've always initiated primary care assignments more now than ever. And having the same team member, the same group working in the memory care area is critically important too, because you know who those people are, you know their identities, you know what makes them tick, you know what can be a fancy way of getting them back into the room, you know their favorite snacks, how to increase and help someone be reminded to drink more fluids. They just know the people. So the more primary, the better. Limiting the number of people going in and out of the room, and this is what we're calling a cohorting, like looking at an individual who can do more universal work. So not having a housekeeping, a dining servant, activity person, and a nurse's aide, all multiple people going into the room at the same time. Try to cross-train and cross-task so you can minimize the amount of people going into resident rooms. Also developing an individualized plan, and this means going back to some basic things, thinking about the individuals in your memory care program and saying, what does that plan look like for this person? We know that Mary is very mobile. We know that she likes to move about the program. We know that she gets easily agitated at certain things. Thinking about what their needs are from a safety, engagement, and support element is critically important right now. Sketching that out, writing that out confidentially, maybe putting a what do we need to know inside of your cabinet door in their apartment. So in the event that someone says, we have a caregiver that is not able to make it in today and you had to pull someone for some reason or the other, we need to be able to have quick facts on individuals, something that's accessible and visible. Doesn't need to be a full-blown care plan, but it needs to be very specific, straight to the point things that we need to know about a person. And that can be easily tucked inside of their cabinet door or in the bathroom, in their over the sink cabinet, whatever makes sense. But any information is helpful information. And also then really looking at your resident mobility status. So the residents that are immobile are easily able to stay in their apartment when in this type of protocol that we have for social distancing and social isolation, that we also have the ability to identify who our mobile people are too. And being able to have that kind of active list of mobile and immobile and knowing which ways are easy and alternatives to redirect someone is very helpful for the staff. So keep that in mind. And also, again, making those individual plans for your mobile residents who are oftentimes trying to exit seek. And they're the individuals that are a little bit more difficult to kind of help with isolation protocol. On infection control, we look at 3 core areas here: cleaning. We all have practice and protocols and policy in place for consistent disinfecting and cleaning. That has not stopped. If anything, it has increased. Think about the amount of times people are touching all the different hard surfaces, such as the doorknobs and handrails and all other surfaces, particularly in memory care. So those residents who are a little difficult to stay in their room, they are touching things more frequently than, say, an assisted living resident is. So keep in mind multiple times a day for disinfecting is a key mitigation step. Also identifying a consistent housekeeper too, having supplies stocked in the program and stocked and accessible, so you don't run out and you need things, you get them. Hand hygiene, of course, is a constant reminder. We all know that. This is what we've been doing all day long. And one thing with memory care, it might be a little bit more difficult for them to continue to be reminded of hand washing. Some best practices that we're seeing out there in the industry, as well as even in our own communities, is posting some hand washing reminders. Don't forget to wash your hands right on the sink, right by the sink, on the mirror, on the inside of the bathroom door, is another reminder for residents to maybe trigger to go back and wash their hands. Implementing on the Invest2Go kind of program is think about, the towelettes, warming them up in the microwave and having a nice warm towel service. That who doesn't like that before meals, to make it more programmatic. Also, again, signage is always a good thing, but hand sanitizer, as we talked about with the PPE use, is using hand sanitizer, make it into more of a hand massage where you're wearing gloves and you're putting, hand sanitizer on their hands and making it more fun and relaxing so it doesn't feel like a forced hand washing protocol. So again, some creative things to think about when we're trying to implement more hand hygiene within memory care. On the PPE side of things, again, organization is critical. Making sure that your PPE inventory is organized, it's in a safe place, that your residents are not walking away with the cart with all the PPE supplies on it and touching that. Also training, again, all staff on proper PPE donning and doffing, which we've been doing and sending out information. Some team members have actually taken those flyers from the CDC that we sent before and posted them on outside resident doors, stop signs on resident doors, or if there was a positive COVID-19 case. Again, any reminder for staff is very, very helpful for them. And also looking at a key employee to check proper PPE use. That's a buddy system. And post appropriate signage as well outside the resident rooms, as I said. Anything that you can do that is consistent reminders has been very helpful and a best practice in many of our buildings to date. On the safety side, again, we've minimized and changed our essential personnel and visitor restrictions multiple times to continue to get and alleviate anyone working in other healthcare settings into our communities. What that means is a lot of physical therapy or restorative therapists that were coming in to work with our residents have minimized or been stopped. And to minimize falls, if we think about what's happening in our memory care programs, scheduled walks is just a perfect way to continue supportive for our residents that are very mobile. Doing that on a schedule, so every 15 minutes there might be someone signed up. They can walk the program, wearing a mask with the caregiver or outdoors and getting some fresh air. In-room or doorway exercising and stretching. Hydration cart for fluids, again, can't press this enough, making this more of the engagement program too. This can be fun in looking at different ways that hydration can be shared. It's not just about water and ice. It could be any other type of things that would be interesting for the resident to drink or to eat, jellos, anything that we can do differently. But that should be multiple times a day. What we know for our memory care residents, if they're eating in the rooms and need prompts and cueing and things of that nature, this is critical that we continue with the hydration card. So people who get dehydrated, we know are an increased chance for falls. Dining supervision. Dining is, again, we've stressed this multiple times with social distancing. We do know that some buildings may still be using their dining room for particular residents. The goal is to have more residents in the room dining if able. In those dining rooms, they should be socially distanced, 6 feet apart. Tables should be rearranged as needed. They should not be sitting all next to each other. Dining in doorways is also another creative methodology. They have tray tables or a table they can put inside their doorway, so tray service can be delivered, but they're visually in your eyesight, so to continually prompt and remind. Staggered dining times for those that need physical assistance. This might be changes every day. So if you're not having a full dining room operation, which we should not be doing, Then think about different ways to stagger your dining time so all residents are getting the prompt and needed attention. And also having a check off for meal diet, confirmation, distribution, completion. Again, it's a different day. Residents are spending more time in the room. It's a little bit, it's a little harder to have eyes on everyone. So making sure you have kind of a very organized methodology for meal delivery, and always having extra supplies on hand too. On the social distancing side, again, we can't stress this enough. Stop signs have been an easy way to kind of minimize residents from going into different areas that they shouldn't be going into. Furniture placement is probably one of the most simplistic things that everyone can do if you haven't done it already. And that is like looking at your dining room, looking at your small living spaces when residents are hard to control and they're coming out of their apartments. If you physically place your furniture differently so it is 6 feet apart, then there's no reason why residents are sitting so close to one another. Again, they're not going to move furniture next to each other. If you place it yourselves in a distance that is 6 feet apart, then you're less likelihood to have people connecting too close for person-to-person contact. And then if there is a program, because you have too many mobile people and behaviorally, you're looking at really minimizing that to 2 to 4 people, again, 6 feet apart, and utilizing very unique programs to make it engaging, but also safe. And that goes into the engagement side. We have EFL on the go and Invest on the Go is a little bit different, right? Again, this is always about infection control too, wearing gloves and masks for delivery, rolling carts with music supplies, scheduling afternoon snack programs, something that's nutritional, something a little bit more easy to deliver, something handheld. Individual programming. What we know about our butterfly kits too is that the butterfly kits have always been meant to be tabletop programs for maybe multiple people, such as folding laundry or rolling yarn or things of that nature. In today's age, we need to be very strategic on thinking about creating a butterfly kit for the individual. And this could be in the room or on tabletop in their room, make it very personalized and sanitize after each use, or just have it and keep it in the room. So it's theirs to have. So you don't have to keep, what we don't want is moving supplies around the unit from room to room. Again, scheduling walks or escort, even for the residents who are immobile. Again, they need to come out of the room too. So going outside in the courtyards one at a time, giving some fresh air is important. And again, scheduling those small groups we talked about. And think about when you do small groups for people in memory care, sometimes it's the easiest things that are the most successful. And it's a win-win for everyone from a safety perspective, but just doing singing, doing trivia, reading stories, talking, reminiscing, word games, things that don't require a lot of hand to mouth to touch type of supplies like bingo chips and all those type of things that can be a little cumbersome to continue to disinfect and sanitize. Not that you can't do it, but you have to be extra cautious. But sometimes the most engaging are some of the programs that are just listed here. So think about things that would keep people engaged, but that don't necessarily require too much preparation and too much supplies. Again, technology has been just so favorable and everyone's using it fantastically. And whether you're scheduling something for one person and it's a family member on the other side, we see all the photos coming through and it's just priceless. And families at this time, and we'll talk about support next, is that these are a lot of families that come and see mom or dad that don't remember them now. And they're struggling with that. They're struggling with not seeing them. So using FaceTime and Skype, iPads, and so forth to be able to make that connection is a really important time at this point. And also using the iPad too, if you're going into a resident's room, that find the movie clips, and they're short. Find movie clips or videos or anything that are very personalized to them, and the favorite music that they like. The certain operas and things like that will help them feel connected to and more engaged in this time. And on the support side, it's not just about family support, but it's also about team support and resident support. And some best practices currently that we're doing out there and will continue to do is to think about ways to continually support the families. The Alzheimer's Association is now offering virtual support groups. I know specifically in New Jersey they're doing that. We'll get more information on that and share that around. that's an easy way to guide the family members to their local chapter to participate in a virtual support group. And also there are hotlines and everything else through the National Alzheimer's Association that is continually a support for them as well. For those who have neuropsychology services, again, we're looking at neuropsychology now and how that service has been modified, but always with them, and we'll get more information on this and share that for the buildings that have a neuropsychologist, is how we can utilize them in a different way, more from psychology to counseling to scheduled calls with families to be very helpful during this time. And again, communication comes in all forms: simple notes, text, pictures, letters. A way to send something to families is always incredibly important. And again, the coordinated video for healthcare check-ins as well. On the team support, we're looking at including all shifts and staff and shift report. The more information, the better. So if you have your dedicated team in memory care, rallying them in so they're well aware of all the residents, how they're doing, anybody who has a temperature, anybody who is getting tested or things, everyone should know that information and the best protocol and practice and the reminders about PPE use. Also providing training and supporting to minimize anxiety. So again, this is a time where all of our staff members are a little uneasy, not quite sure how to handle if someone were to be positive in memory care and they're not staying in the room, and how do we handle this? This is a team approach. So the more that they can be educated, the more that they can feel confident in their role. That's all of our jobs to help them do that. We want people all coming to work and feeling comfortable coming to work and knowing that they're making a difference and being a hero at this time. And on the resident support side, the easiest thing I can say here is that the more that we know about each individual, we can create more of a calming environment, even in the room. And keeping in mind, when every time we go into a resident room, think about the temperature, think about the lighting, think about the furniture layout. Is their chair the most comfortable chair in their room that they're sitting on? Is it accessible to the tray table where their meals are? Do they have the fun things that they like to do in close proximity to them? Is their TV on with the right channel, with the right famous movies that they love? Is there a Amazon Echo in the room? Is there a radio in their room? Is there anything there that can always be turned on to music to keep a soothing environment? So lighting, music, room temperature, furniture layout, comfort is something that we can all spend some time thinking about and looking at in each resident room, and think about other things that might be soothing for them. We have a lot of residents that like the lifelike dolls. We have a lot of residents that have those cats and dogs that look a little strangely real and make a lot of noises that sound real, but sitting on their lap and petting them, what I would say is that identify one per person so we don't have those things that are moving from unit to unit and room to room. And again, with all of us, it doesn't have to be just our clinical team, but monitor for anxiety and signs of distress. And that's going to be, that's going to happen. And some of those residents are probably already exhibiting that. There's a lot of change and in a very short period of time, and a lot of new protocols in a very short period of time. So provide that one-on-one and reassurance. And again, educate everyone. So I think what we're going to do is we'll send this recording and we'll send also the PowerPoint out after the program here, considering there was some oddity with other people in another meeting by themselves. Pardon for that glitch, and we'll course correct. I think as we go through this process, guys, we'll see another version 2 of this program as we get more into any issues related to more positive cases. And we will continue to come back to this and continue to educate. If you feel that there's anything that pops up that you would feel or recommend a training on for your frontline staff or for nursing or whomever, feel free to let us know that. We have plenty of our corporate team members who are geared up and ready to help with any type of education. You can print these tools out, this PowerPoint out, and share with your frontline too. With your team members in escapades as well as clinical, if you find them helpful. And also, use it as a checkpoint for yourself to kind of self-assess your unit operation today and to say, are we doing these now? And if not, why don't we put them into practice, right? So take that tool as kind of a checkpoint And we'll bundle some of these other best practices that were shared today into another document also, and share that around to the company. Okay. All right, everyone. Well, it is close to 11:30, so I know everyone's incredibly busy. Again, just just to remind you that the corporate team in all capacities is here to help you, guide you, give you any instruction or support that you need. And on behalf of Brandywine, again, stay strong, and we're in this together. And thank you so much. Thank you,
Thank
guys.
you, Maria. Thank
Thank
you.
you. Thank you, Maria.
Thank you.